The posterior tibial slope is measured either on the medial tibial plateau or on the lateral tibial plateau on a lateral view X-ray of the tibia. Traditionally, either the anterior tibial line or the posterior tibial line or the anatomical axis or mechanical axis of tibia is taken as a reference for measuring the posterior tibial slope. The measure of tibial slope differs depending on the reference line we take into consideration. One should therefore be careful while considering the postoperative desired tibial slope according to the reference line chosen. Calculating the degree of surgical correction to be done should also vary accordingly to avoid erroneous results. There is no international standardization on the length of the tibia for a short X-ray. Neither is there any standardization on the points or levels of tibia to be considered for marking the reference lines on the posterior or anterior tibial cortex or even the anatomical axis. As a result, there is a high degree of inter-observer error in marking of these lines on the short lateral X-ray. This inter-observer error leads to a significant error in measurement of the tibial slope. These calculations would be even more erroneous and difficult in presence of a deformed tibia, since the lines would be difficult to demarcate. The best way to standardize and avoid inter-observer errors of calculating the tibial slope is to have a full-length X-ray of tibia in the lateral view and use its mechanical axis as the line of reference. Points for marking the mechanical axis of tibia in lateral view have been standardized internationally. The line extends from midpoint of tibial plateau to midpoint of tibial plafond at the distal tibia. There is no significant inter-observer error in marking this line, and therefore the measurement of tibial slope using this as the reference line is without errors. One can standardize measuring the tibial slope using mechanical axis. However, calculation of angular correction to be done becomes erroneous using the traditional simplistic calculation technique if applied with the mechanical axis. Here TS is the tibial slope line, POCA, which is point of calculation of angle, is the midpoint of the tibial plateau, U is the midpoint of the tibial plafond, MA is the mechanical axis, HL is the horizontal line drawn perpendicular to MA. At the POCA, T-S- is the planned postoperative tibial slope line. In the traditional simplistic method of calculation, the difference in angular measurement of the preoperative posterior tibial slope angle, PTS, and the planned postoperative corrected posterior tibial slope angle, CPTS, is considered as the osteotomy correction angle, OCA, and is used for opening or closing the wedge. In this case, the OCA is therefore 10 degrees. If this osteotomy correction angle is used to replicate the osteotomy at the axis of correction of angulation, and we close the osteotomy wedge, the posterior tibial slope achieved remains more than the planned corrected posterior tibial slope angle. Therefore, there is an undercorrection error using this traditional calculation technique. The error is magnified further as the ACA moves more distal to the joint line, and more exaggerated as OCA increases. The precision technique is devised to avoid errors in calculation and to standardize precise calculation of OCA irrespective of position of the ACA. Here, in this case, we plan to reduce posterior tibial slope from 20 degrees to a postoperative value of 5 degrees. We therefore subtract the difference in tibial slopes, which is 15 degrees, from the anterior proximal tibial angle to get our new planned postoperative mechanical axis, MA-. We then extend an arc of radius ACA to U onto the new mechanical axis MA- till it intersects at point U-. This measure of angle UACA U- is the final precise osteotomy correction angle. As we see here, when we replicate the osteotomy using this OCA, we get the precise corrected planned postoperative posterior tibial slope value of 5 degrees without any errors. We note that, as the position of the ACA changes, the value of osteotomy correction angle also changes. It is this precise value of the osteotomy correction angle that gives us the precise postoperative planned posterior tibial slope value.